If you're like me, when you talk to clients about their pet's behavior, they get wrapped up in the why. Why does my dog act like this? My best friend said it was my fault. My partner said the dog only acts this way with me. I hear it all the time. And have you ever noticed that pet parents are not saying that when you diagnose their dog, let's say, with cancer? They might ask, is it something I fed or something in my yard? And you'll say, well, we really don't know, and they'll let it go. Same with heart disease, kidney disease. But with behavior problems, they come back again at the next appointment. Why is this happening? My sister said that it must be my fault because my dog sleeps with me, right? Okay, let me tell you what to tell them. There's only a couple reasons why behavior problems develop. Number one, things that cause behavior problems. It's in the DNA. It's in the soup, is what my friend used to say. So whatever genetics that dog or cat inherited set them up for a certain ability to cope, ability to be resilient in the face of trauma, right? All of that stuff affects that particular animal's behavior, and that is outside of the pet parent's control, okay? Number two, is the patient sick? That is a huge, huge part of dog and cat behavior problems. Any sort of discomfort like pruritus, GI, musculoskeletal, it doesn't matter. Even if you think it's minor discomfort, it's enough to change behavior. All right, number three, trauma. Trauma and learning. Trauma is in the eye of the dog or cat. It's not for you to judge if it was traumatic. One trip to the vet is enough to make a cat hate every vet she ever sees for the rest of her life. That's trauma, okay? So any sort of traumatic incident viewed by the dog or cat as traumatic can alter behavior in a very permanent way. Another thing that can cause trauma or not are the training methods and the interactions between the pet parent and the animals. Okay, so we want pet parents to use training methods that are scientifically valid, that are positive reinforcement based with dogs and with cats, and we want to make sure that pet parents understand the language of dogs and cats so that they don't end up provoking a bite and then saying it was unprovoked, which it almost never is. Now you know how to talk to clients about the why of behavior change. Let me give you a little script. Client comes in with her cat that bites her. She says, I've had cats my whole life. I have never had a cat like this. And then you first show empathy. I'm sorry this is happening to you. It totally sucks that your cat is biting you while you're sleeping, and on the face, no less. That's really stressful. But I gotta tell you something. It's not uncommon. So you're gonna go ahead there and normalize it, right? I see cats all the time that do this, and we have a lot of treatments. Give the client hope. We have a lot of treatments. I also want to tell you that you didn't cause this. You may have contributed with something that you did, like nobody's perfect, but most cats come to their pet parents this way. We just need to help you to learn how to interact with this cat and teach the cat how to interact with you. There are tons of things that we can do to help you and your cat. Priority number one is to make sure your cat's healthy, and that's what we're going to do today. That simple way of talking to pet parents helps them to know that you are empathizing with them, that you see this all the time, that there are lots of treatments, and that you have a plan. Try talking to clients in that way, and hopefully you will not be asked why again and again and again.